Today's conversation is one that so many of us need to hear, especially if you've ever felt like you have to earn your rest, prove your worth by overworking, or carry the entire household mental load without complaint. I'm sitting down with Karen Leitner, and we're diving into the guilt so many moms feel around self-care, what real self-compassion looks like, and how we can stop internalizing the outrageous expectations society and medicine put on us. If you've ever felt like you're failing while you're doing it all, this is your reminder that you are not alone and you don't have to keep pushing through. Hey, I'm Dr. Angela Downey, and this is Paging Dr. Mom, the podcast for women who are juggling careers, kids, chaos, and cold cups of coffee. We're talking about the real life behind the resumes, the messy moments, big feelings, and how to stay human when you're doing all the things. If you've ever felt like the only one trying to keep it together, you're not. We're going to laugh, cry, vent, and thrive together. So here we go. Hello to all my busy mamas. I'm Dr. Angela Downey, and I'm so glad that you're hanging out with me on Paging Dr. Mom. This podcast is for all of us who are just trying to keep it all together while juggling kids, careers, and whatever else life throws our way. We will explore all of those moments that we definitely wouldn't be putting on our resumes. I am very excited to introduce you to today's guest. Dr. Karen Leitner is a physician and certified coach who helps women enhance well-being, reduce burnout, and grow as leaders. She's the founder of Karen Leitner MD Coaching and an ambassador for the Laura Breen Foundation, which advocates for clinician mental health. After training at Brown, the University of Rochester, and Mount Sinai, she held roles in primary care, academic medicine, and digital health before launching her coaching business. She lives outside Boston with her husband, 3 daughters, and her beloved mini golden doodle, Oscar. Hi, Karen. It's so great to have you on Paging Dr. Mom today. How are you doing?
I'm great. Thanks for having me.
I am so thrilled to have you on the show, not just because of the incredible work that you do with women physicians, but I must admit I'm just a little bit starstruck because I remember messaging you several years ago, thanking you for all the wonderful work that you do. And I was really grateful to have you there when I was going through a period of burnout. So thank you for all the media that you put out there, and you bring this really grounded, compassionate perspective that makes me feel like I don't need to hustle my way into worthiness. So thank you for being here today.
So nice. Thank you so much. I mean,
Yeah.
the reason I do it is because I wish I had had someone to do any of that for me when I was going through it, So I've lived it all too.
Yeah.
But that means a lot. Thank you.
Yeah, I think when we're struggling, we feel kind of alone and like everyone else has it all together and we like, why can't I keep it together?
Yeah.
And so it's really nice when someone's willing to put themselves out there and just say that they've struggled as well and to offer support. So maybe let's start by having you introduce yourself and tell us about your journey to becoming a life coach for female physicians.
All right. Yeah, I was putting my makeup on, getting ready for this, and I was thinking about this. I've thought about it so many times. People have asked me that so many times. I never woke up one day and was like, I think I want to be a life coach. Like, that wasn't part of how this came about. I wouldn't have expected it if you asked me. But what happened was I had a hard time in training. I think mental health wise, I had a lot of anxiety. I had ADHD and I didn't know it. I was super unhappy. I remember I used to message my mom and be like, I think I've made a huge mistake in medicine. And she was always like, just keep going. And it was that difference between like the internal struggle and the external struggle, which you kind of alluded to. It's like, how many of us are struggling and you wouldn't even know because we're trying so hard to pull ourselves together. And then I got a job after a great job, and I loved it in the beginning. And then I had my kids, and I sort of like blew up because I was trying to do everything like 150% as we all do. And I wanted an A in being a mom and being a doctor. And I really felt like I was getting an F. And so I didn't know I was having burnout. I thought I was just couldn't handle it. And I left my practice, which was really hard, my patients. So I felt a ton of shame and guilt and inadequacy and all those negative feelings. And the interesting part is, like, I recovered from that. I looked for 100 different jobs to try to find the job that was going to feel right for me. I just thought it was the job. And I did a lot of things, but none of them really fixed the idea that I was just like, this doesn't feel right, or I'm not that happy. Until I got a job doing medical patient advocacy, which I really loved actually. But along the way, I started listening to some coaching podcasts and found that they I remember listening to the first one where it just said, your thoughts create your feelings. And I was like, what? Like my
Yeah.
thoughts are the reason I feel anxious
Mhm.
and overwhelmed and embarrassed and ashamed because my thoughts, and I can maybe have some control over those and I don't have to believe all the thoughts that come up in my brain. So
Mhm.
I really started to apply those tools to myself for a long time, and they helped so much. So I don't know if you have this commercial in Canada. I was thinking about this too this morning, but there used to be this old TV commercial or like on the radio talking about the hair club for men. Do you know that?
Okay.
The hair club for
I know
men.
the club. I just don't know if I know
Okay.
the commercial.
This guy would come on and he would, I forget what he would say, but it was the hair club for men. And at the end he'd say, and I'm not just the founder, I'm also a client, because he also like
Mhm.
had hair loss. And I was thinking like, I was my first client. I did all this work on myself. I changed my mindset. I changed how I saw myself. I worked on having more self-compassion. I had to let go of perfectionism and just sort of go through all these and do things that felt really uncomfortable and outside my comfort zone. Stop fixating on pleasing people all the time.
Mhm.
And it made a huge difference in my life. And then this is the long version, but you told me we have lots of time, so I'm just giving
Mhm.
it all to you. My company I was working for got acquired, and I found myself going from feeling like amazing at work and loving it and feeling so impactful and having seniority and like just living large, and also is very rewarding, to feeling now like resentful, stuck,
Mhm.
bitter, undervalued, as you can imagine, is similar
Mhm.
to how a lot of us feel when we're going through burnout. So I hired a coach. I joined a coaching program actually because I was like, yes, some of these help me, but now I need like professional help.
Mhm.
And that was so powerful and helped me so much more. So that's when I decided to train to become a coach because I wanted more for myself. And then during the pandemic, I realized because I wasn't seeing patients and I wasn't at risk for getting COVID, I wanted to get back to the doctor community where I live. And I offered volunteer coaching for people. And then it was just from there, I started my business and it took off. That's how I
Yeah.
found it. Yeah.
Yeah, that's quite the journey that you've gone through. And a lot of us going through medical school, we don't have those types of courses to teach us how to take care of ourselves and teach us like what we need to do to be mentally well. So why do
Well,
you
can I say
think
something about that? Like,
yes,
not only do we
please.
not have the courses, but the medical system itself traumatizes us. Like, it is
Yeah.
traumatic to see people sick and dying and to be under resourced
Mhm.
and so it's like it creates some of the need for the supports and then it doesn't provide them for us. So it's a double
Yeah.
whammy. Hmm.
Yeah. I remember thinking that like the medical system just I never really felt supported by it. So I would see, I'd be on the ward, somebody would call in sick and you'd almost be shamed for calling in sick. Like, oh, I went in when I was sick. Like, why can't you do the same? And,
Right.
we write all these notes for other people to be off work, but yet insist on going into work. Like, I've had a colleague call and say, I've got strep throat. I'm dying, but I feel guilty for calling in sick and all these patients are going to have to get rescheduled. And so I don't know. It's like we don't have this feeling that we can take time to take care of ourselves and have patients get canceled. So why do you think a lot of us feel guilty just for taking care of ourselves?
Well, it's like you said. I mean, in training, if you call out, it's like you are giving someone else, like you're making
Yeah.
someone else go in for you. And
Yeah.
that is not encouraged. It's not like we all help each other out. It's like very individualistic. It's very under resourced. So like, why isn't there an abundance of people to meet the need, right? That we're like skeleton crew. And so you take one key person out of the rotation and now everyone else
Yeah.
is struggling. So, I think that's part of why we feel that way in training. And then it just carries through. But the culture
Hmm.
tells us to be self-sacrificial and
Yeah.
and stoic and not show vulnerability and not be weak, not be perceived as weak. So um a lot of systems rely on people to just not question. And I would argue it's sort of like um the system would collapse if we all realized we have agency and we can take better care of ourselves.
Hmm.
So it's
For
sort of,
sure.
it preys on our generosity and our caring and our compassion and our dedication and how hardworking we are. And so
Hmm.
it's, you have to start to separate like, well, at what point can we keep blaming the system for what sometimes we're perpetuating on ourselves, right? Like we still get to
Hmm.
say, I'm going to go in, I'm not going to go in. I'm going to take the consequences. But the
Yeah.
guilt is like I'm doing something wrong. And
Yeah.
we don't believe it's wrong to take care of ourselves. So a lot of it is, we have to be uncomfortable, and we are sort of evolutionarily designed to want to fit in and belong and not be rejected,
Sure.
because you would
Yeah.
die out on the plains if you
You
were a
would
cave
die. Yeah.
person. Right.
Yeah.
And it's the same thing when everyone in medicine is showing up, even when they're sick, and coming back after a week of maternity leave and doing all this crazy stuff. Although you guys, at least from what I hear, it's not that bad. But even in the States, I can't tell you how many women have said 2 weeks and I went back. And even
Yeah.
paid maternity leave isn't guaranteed in every state.
Yeah.
So it's like you have to go against the grain when you show care for yourself. And that's uncomfortable. And it's not modeled for us. So there's a lot of
Yeah.
confounding variables. Yeah.
Yeah. Calling in sick is definitely uncomfortable, and feeling like you're putting pressure on your colleagues to take over the slack. So you mentioned mat leave. So how did motherhood shape your own career path? This episode includes a paid partnership with BetterHelp. 3 years ago, I hit a wall. I was so burnt out that I walked away from my family practice. I thought I hated it and might never go back. But what I really needed was to face my people-pleasing, the chronic guilt, and the fear of conflict that had been weighing me down since childhood. It took a lot of therapy to work through those roots. But because of that, I'm able to come into medicine in a way that I actually enjoy again. That's why I believe that therapy is crucial. Not just when you're in a crisis, but for staying grounded and being the best version of yourself. I've been working with a credentialed therapist through BetterHelp, and it's been such a supportive part of my routine. After each session, I feel clearer and stronger. BetterHelp makes starting therapy easier. You fill out a short questionnaire and get matched with a therapist quickly. And if it doesn't feel like the right fit, you can switch anytime at no extra cost. With over 7,000 reviews and a 4.3 rating on Trustpilot, it's a platform that you can trust. Click the link in my show notes, betterhelp.com/Dr. Downey, to get 10% off your first month.
Oh, that's such a great question. I really think when I was choosing medicine, it didn't occur to me to think about how would I fit in kids and what if I have these other needs I have to meet. I also think when I look back, I did internal medicine and pediatrics. And so I wanted to know how to take care of the sickest of the sick. Like I wanted that knowledge. And once I had my own kids, emotionally, it became challenging for me. Like I didn't, it was a lot harder for me to imagine kids being very sick and then me taking care of them. I haven't heard that from a ton of people in pediatrics, but that was part of it for me. But the biggest thing was I suddenly felt like pulled in two directions. And I had like double the guilt, because I used to just have guilt like if I wasn't working hard enough. But now if you work harder, then you have guilt because you're not there caring for your kids. So women have this extra pressure, like the double bind, where we're expected to like do everything and be everything, but we're not given the supports to succeed in either arena, and that's a huge generalization, but most people, there's still a gender disparity in the way the household works and childcare and who's the default parent. And so for me, I felt this responsibility because I wanted to be there for my kids so much. And I would just try to shrink my job so I could fit it all. But I never found a way to do that very successfully because I was still trying to perfect and people please, which is what you're talking about. We don't want to let anyone else down. We don't want to ask for something for ourselves that might make someone else uncomfortable. So it was a perfect storm for burnout for me.
Yeah, for sure. I always tried to give my kids like 100% of whatever energy I had left. But there just wasn't that much energy left. So like 100% of 10% is like not a lot. And it was really hard for me to juggle how much to give in one place and how much to give in another place. And when you're trying to give 110% in both places, you will burn out. Like it catches up with you, and you do everything to take care of everybody else, your patients and your kids, but not yourself.
Yeah.
And that's challenging.
It is. And I think, just going back to some of the things that come up a lot in coaching, we tend to be very black and white, like all or nothing thinkers in medicine a lot of the time. It's like, do they have a PE or do they not? You can't be like, well, they might, but they might, you kind of just like are looking for that answer. I think it makes a lot of us fixate on the areas where we're falling short. And we like hyper focus on that. We call that the gap. Most of us, the that I have experienced are very hard on ourselves for the way we mother, even when we're already doing a good job. I wasn't doing a bad job. I was just telling myself I wasn't doing a good job all the time because I was so fixated on like, and their hair isn't brushed. And
Yeah.
I didn't realize the diapers needed to be a bigger size, you know? So it's that
Yeah.
inner monologue where we're just never happy with how we've
Hmm.
done. It's never enough. A lot of it has to do with just scarcity
Yeah.
thinking, which is like, I'm not enough. I'm not a good enough doctor. I'm not a good enough mom. I don't have enough money. I haven't done enough charts. Like it just, the thinking follows us around. Like, what is a good enough mom? Like, tell me,
Yeah.
you know? And when someone does answer that, it often
Yeah.
is like, would you ever tell a patient, you know, oh, you work 40, 60 hours a
Yeah.
week? You're not a good mom. But like, we think
Hmm.
it about ourselves,
Hmm.
you know? So
We
that's a
also see
huge,
social media, right?
yeah.
Showing
Oh, for
us, all
sure.
these pictures of these families doing these like amazing things together. And you're like, wow, I'm just really happy that I got my kid to brush their teeth today and that their clothes aren't wrinkled. And but it's hard when we get these messages all the time on media of what motherhood should look like.
Oh, yeah, that's a whole other category. I mean, it's and people lying on social media, but then it's also the patriarchy. It's like the system was designed for men and all the leadership
Hmm.
was men. And even like the advertisements that created the idea that we're supposed to like wear high heels and vacuum and give our husband a martini when they come home, that was marketing from advertising agencies, but it sinks
Yeah.
into our collective
Yeah.
subconscious. So then we have these
Yeah.
expectations of what we're supposed to be able to do that are totally not realistic. And then we are judged, you know, we are discriminated against by like the
Yeah.
misogyny that's also really prevalent in a lot of Western culture. So it is
Hmm.
very multifactorial. It is not just something that
Yeah.
we put on ourselves, but the part that we have control over is the narrative we want to believe. Forget about what we're being told. It's like, okay, but
Right.
I want to know in my heart that I'm a good mom and I get to decide. I
But
think,
worrying about what other people are going to think about you just perpetuates um this idea that you need to be perfect and just makes you feel bad about the job you're doing.
yes. And the meanest person is always going
Hmm.
to be you. It's
Yeah.
listening to the mean version of you telling yourself. And again, maybe some people don't identify with that, but by and large, like we had to be kind of drill sergeanty to achieve and to get into medical school and to get through training and to survive 30 hours on call. We have this like, come on, suck it up, be tough, don't mess up. What's your
Hmm.
problem?
Hmm.
And that we just continue that constantly. And that for me was, I think, the biggest like epiphany I had, or the thing that made me the happiest was realizing I don't have to talk to myself like that anymore.
Yeah.
Like I'm at like, what do I'm I'm doing the best job I can. I'm going to be flawed.
Yeah.
I'm a human being, it turns out. And that messaging, right? When I go on social media and I'm like, I'm flawed and you're flawed and it's
Yeah.
okay. How about we all stop pretending? It
Yeah.
resonates so much. Like we're all pretending in medicine. You noticed?
Hmm.
I
Hmm.
think.
For sure. The it's interesting that you bring up like the 30-hour shifts because I would never stay up for 30 hours ever. I feel like it's super unhealthy. I love my sleep. I think sleep is so important. But yet, the medical system, when you're in training, you're expected to stay up for 30 hours. And they're like, you know what? Studies have shown that this doesn't cause you to not perform properly. So do it, right? And so it's almost like our training has taught us to ignore our bodies and ignore our feelings because they need us to work.
Yeah.
So we've trained ourselves that we're the last priority,
Mhm.
and whatever our bodies are telling us that we need to do, it's not real, and to ignore it.
I think like a lot of the things you're talking about are how we've internalized these really unhealthy messages. Like if you
Hmm.
were going to set up a system, like the ideal system for
Yeah.
medical trainees, would it be 30 hours on, underslept and underfed and underpaid? Like there's very high rates of untreated, there's very high suicidal
Yeah.
ideation in training. So obviously the way it's set up is not working. But
Hmm.
instead of us all like rallying together to change it, we take that and we use it against ourselves. Oh, I'm the only one who's so tired who can't make it for 30 hours. Like, what's wrong with me? I'm the
Yeah.
problem, you know?
Yeah.
So we've sort of been a little bit brainwashed. Like I think of it like Stockholm syndrome, like someone kidnaps
Hmm.
you, but then you want to protect the kidnapper. It's like, we would never tell our patients, go to work when you're sick, but we do it because of that, what we've internalized from the toxic culture of the workplace. And I think it's just important to call it out.
Yeah. I had a couple rough years in medicine. You talked about you going through burnout, and I did the same. I think I was actually burning out before COVID hit. And then COVID came, and then I was like, oh, okay, like I need to rally. I need to get myself together because COVID's coming and we need to do all this stuff. So, a couple of years into COVID, I just felt myself burning out more and more and more. And I could feel myself getting tired. I could feel myself getting really short with patience. My patience was like razor thin. And I think my body kept telling me to slow down, but I was like, no, I need to keep going. And my stomach was upset all the time. And I started to feel, like a lot of back pain. And I didn't know what was wrong with me. And it turns out I had like osteomyelitis and septic arthritis of the sternoclavicular joint. I have no idea how I got that. But even with that, I kept pushing myself to go into work. So I had like 5 hours of IV treatment every day. I would do like 2.5 hours before clinic and 2.5 hours after. I kept going in because I felt like I couldn't say no to my patients. I didn't want anybody else to pick up the slack. So I kept pushing and pushing. And this went on for like 6 months. And I wasn't getting better. And at that point, I started having heart palpitations. So my body would just start like falling apart. And like, I don't know why I felt like I needed to keep going. It's like I always felt this need to just keep pushing through, and I could, grab energy from wherever I could find it and just keep going. But I became like a horrible person.
Wait, I'm sorry.
No.
No, no. Let's back up for a second. You're like, I don't know why I kept pushing and pushing. I'm like, yes, you do, because
Yeah.
that's what we are told to do.
Mm-hmm. Yeah.
So
Yeah, for
I have
sure.
to reject in any way that you were a horrible person, but perhaps there were
Yeah.
some ways you were showing up that you didn't like and didn't align with how you see yourself. What do
Yeah.
you mean by that?
So I mean, like, the stuff that I would say to patients, I just became
Mm,
so
mm,
resentful of
mm,
everybody who
mm-hmm.
wanted any of my time.
Of
So if
course.
anybody wanted any of my time, I was like so upset. I'm like thinking to myself, like, who are you to be complaining about your everyday problems when I have this going on and nobody cares
Yes.
about me? But
Yes.
and it took a long time, like way past when I actually like healed from my infection, to realize that I was actually giving people permission to take my time. And I was like allowing that to happen.
How did
And
you realize that?
lots of therapy.
Okay.
Yeah, lots of therapy. But at the time, I don't think I could see it. So I was just going into work every day and I would get so angry, and people would be talking to me about their problems. And in my head, I'm thinking, you think you've got problems. I've got this going on. And my IV line is hidden under my sweater here. You can't even see it. So that's what's going through my mind. I could only think about myself and what was going on with me. And it was just making me so angry all the time. And that was just like a culmination of years of just not taking care of myself. And so, yeah, I ended up, telling somebody that they were like my worst patient on my roster, and that when I saw their name in my schedule, I wanted to call in sick that day. And I think we all get those kind of like gut sinking feelings with certain patients sometimes who are emotionally really heavy, but we have a filter. And we know not to say these things, and we know how to regulate our emotions. But at my peak of burnout, I was not able to do that.
Yeah.
And it just became so overwhelming that I just one day just walked away. I shut down my family practice and I walked away. It was really hard for me to see the role that I had actually played in that. I'm the only one who can protect myself. I'm the one who has to say, you know what, I'm not feeling well. I need to take care of myself, because no one else is going to do that for me. And it took me a long time to realize that. Why do you think we do that to ourselves? And you talked about like the system has taught us to be like that. This is probably messaging that we get when we're children too, right?
Well, I just
Of
wanted to say, like, I'm so sorry that you went through all of that.
Yeah.
And thank you so much for just sharing it so openly. It's still painful to hear and to imagine you going through
Hmm.
something like that. Like, you are hurting. That's
Yeah.
how it shows up when you're hurting inside. Your body is hurting and your mind and your mental health is hurting. And so I wanted to just sort of briefly just define what burnout is because it's used so much,
Please.
sort of colloquial,
Hmm.
in the oh, I'm so burned out, but like what do we actually mean? And everything you're describing is like classic thing is first thing is emotional exhaustion. Not just being tired, not just being so sleepy you want to sleep, but it's like I don't have anything to give anymore. Like there's just nothing in here. Like tired beyond tired. And then the second
Hmm.
big red flag for people is when you lose your empathy. That is part of burnout.
Yeah.
So you went into this because you care about people and you find yourself not caring. And that is part of the disease. I don't mean disease, but like, sometimes it would be like if you were like, I have diabetes and I'm peeing all the time,
Hmm.
and you're like, I don't
Yeah.
know why I was doing that. It's like, no, but this is defined. This isn't
Yeah.
specific to you. So you lose empathy, emotional exhaustion. And then the third part is sort of lack of personal efficacy. Like, what's the point? Nothing I do matters anymore. Like, why am I even doing
Yeah.
this? So the other thing that I think is just interesting to point out is that resentment, all that resentment that you're feeling, that you're sort of judging. Like we're really good at judging ourselves. We judge
Hmm.
ourselves all day long negatively. So
Sure.
that's also part of being women physicians. But like we talk about resentment as being like drinking poison and expecting your enemy to die. The patients don't feel it
Yeah.
until you say something, until you act on it. They don't feel your resentment. You feel it. So
Yeah.
you're sitting here trying to do this really hard job
Mm.
and then feeling
Yeah.
extra miserable because your brain, I sort of think of it as like the canary in the coal mine. Like when you start to notice yourself being very resentful of others, you have to stop for a second and be like, okay, wait, what do I need that I'm not
Yeah.
getting? And that was
Hmm.
just so in a way, we're like, thank God for the resentment. And thank God that you like lost control of your behavior because that's what saved you and got you out of there. Otherwise, who knows how
Hmm.
much longer you would have kept doing it, right? But the third thing
Yeah.
I wanted to just normalize for you, because, I've spoken to hundreds and hundreds and hundreds of women physicians, is this we have a hard time differentiating between blame and responsibility. Like, for sure, you had some responsibility for what happened during the time because you were the one choosing to go into work and see the patients and, whatever. You made those decisions. There's no one else like puppeting you. So, yeah, you're
Hmm.
responsible. That doesn't mean you have to accept blame or feel bad about it because obviously you were always doing the very best you could in the moment and had
Hmm.
a lot of extenuating circumstances and all these factors like we talked about how we're socialized and how the system pressures us and how it all contributed to that. So I can't tell you how often I'm trying to think of other examples where I see women physicians blaming themselves instead of like we want you to take responsibility and we want to feel like radical responsibility is what I'm always
Hmm.
talking to my clients about because if you don't have any role in it, if you're just zero responsible, then you don't have any control to change it. So if it's
Right.
just my hospital's fault, if it's just the system's fault and medicine is terrible everywhere and it's all, the way it's reimbursed and blah, 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 there's no end. There's nothing for me to do. So I have to find the 1% that maybe I play a role in because that's the only thing I have control over. And when we are focusing our energy on where we have control, we feel so much more in control. And that's part of why I think for me, the mindset coaching was so helpful because I couldn't change if especially with ADHD, like I can't change that I'm going to forget stuff and like double book
Hmm.
stuff and,
Hmm.
make mistakes. I just made such a bad mistake. What was it the other day? I was so bummed about it. And I was like, I cannot even believe I know what it was. My daughter asked me, please go on this website at this time and book these tickets. We can only go on this day. We traveled to Acadia National Park. She wanted to watch the sunrise on this mountain. She's like, Mom, I'm trusting you. I was like, I got it. I got it. And then I set an alarm. I set a timer. I had the password. I had the website. I was sitting there. And then my other daughter distracted me. I don't even know what happened. And then I'm like, well, I still have 10 minutes. Let me go look at this thing. And I don't know if you know with ADHD, you have time blindness. I completely lost all track of time. And suddenly it was like
Sure.
10 minutes past when I was supposed to do it. Like I blew it.
Mm.
And I was like, "Ah," like, I can't believe I did that and let her down so badly. I couldn't believe it. Right. So old me would have just like hated on myself, like beat myself up. What's wrong with me? I suck. But I am able now to be like, oh my gosh, that's so hard when you wanted to do that for her. It's not like a
Mhm.
free pass. So I just
Yeah.
really encourage you to think about like what does self-compassion look like when we retell those
Mhm.
stories of times when we didn't show up the way we wish we had. Like I actually apparently, I don't know, but one of my patients wrote this review of me in like health grades or something. They said I yelled at them. Maybe I did, I don't know. It was someone who I had had on like chronic opiates for a long time. And then they like revealed to me that they had had someone else prescribe or something like that. I don't know. Like we're human beings. So we're still
Yeah.
going to be human sometimes. It's like, how do we treat ourselves after the fact? How do I treat myself
Yeah.
after I yell at my kid? How do I treat myself after I maybe make a mistake? That was another huge one for me is I know I'm like airing all my dirty laundry about the kind of doctor I was. And
Yeah.
I was a really good doctor. I can say that now. But the things no one talks about is you're going to make a mistake. It's just human nature. How are you going
Yeah.
to show up for yourself when that happens? And for, it's like shame, stigma, blame, like beat yourself up, hide, avoid, and, fall off the planet. Like that's how we're taught to handle it.
Yeah.
There's another way. It's like this is part of being a human and a doctor.
I feel like society plays a little bit of a role because they tend to put doctors up on these pedestals and, they forget that we are human and that we do things that sometimes we're not proud of. We make mistakes. So I think that I always had this idea that, and I'm a perfectionist, right? I had to do things in a certain way and be a great doctor all the time. So when I, didn't show up the way I wanted to show up, it was really hard for me to accept that I wasn't fulfilling this role that I felt like I was supposed to be doing.
Well, it turns out, and most people don't know this, that doctors are human beings also.
Sure.
And all
Yeah.
the things that apply to other humans apply to us too. We get sick, wouldn't you
Yeah.
know? Like that's part of the toxic piece of it. Of course, you want to be the
Mhm.
best doctor you can be and you don't want to make mistakes. Of course. But it
Yeah.
is not, we're going to fail. So instead of telling us not to, tell us how to manage it when we do. That's
Yeah.
just life, you know? We got to
Do you
change
think that
messaging.
Do you think that imposter syndrome plays a role in that um I already sometimes don't feel like, it's only a matter of time before they figure out that I don't belong here or, all the other doctors are smarter than me, so I have this thing that I need to prove. So when something does go wrong, it just reconfirms for me everything that I already believed.
Mhm.
Um
Yeah. So I don't It's it's not an actual syndrome. So I say imposter phenomenon because there's no, if you look, it's not like
mhm.
a medically agreed upon thing. So it's like
Okay.
it's the main thought distortions that I have identified through my own stuff, and we're talking through them all right now. That basically like women in medicine subscribe to some or all of these things: the perfectionism, people pleasing, like over self sacrifice, imposter
Yeah.
thinking, learned helplessness, scarcity mindset. So, um, imposter thinking for sure contributes to that, but it's overly prevalent. Like, how can 80% of us be imposters? So, it's even just recognizing that instead
Uh-huh.
of believing I wasn't good enough, I'm like, oh, I was just thinking I'm not good enough. And I think that all day, every day, wherever I go. And then I show
Yeah.
up worse. Right. So it's sort of, yes, I definitely believe that for so many of us, we have these thoughts. And we're also messaged from the external world that we are less than. Like we're called nurse all the time and we're paid less than our male counterparts. And we are, first named and all the things that society does. The patriarchy when we are women or when we have marginalized identities, part of imposter thinking comes from that too, you know?
Mhm.
But um but it's a thought pattern. So what I
Yeah.
encourage people to do is just notice it. Oh, there it is.
Mhm.
Oh, I'm thinking I
Yeah.
don't know enough. And like you have to remind your brain sometimes that you actually do. Like, what are the facts? Well, I'm board certified and I went to med school and I passed my step exams. And then I, practiced for 5 years and I have a
Yeah.
degree. Like, okay, I just have to sit with the dissonance that my brain thinks I don't
Yeah.
know anything, but I have so much evidence that shows I do. And then
Mhm.
just like move on. I talk a lot on imposter thinking, and I feel like another huge piece of it is that self compassion piece. It's like, oh, I feel like I know less than everybody else. Yeah, that's part of the human experience that no one tells
Yeah.
us, right?
I I went to a retreat last year. It was put on by one of my colleagues. It was like a women physician retreat just to kind of get away and to talk about things. And one of the exercises that we did at this retreat was we had to write down on a piece of paper like thoughts that we had about ourselves in medicine.
Uh-huh.
And so many people wrote down things like, my colleagues know more than me.
Uh-huh.
Everyone in my office is a better doctor than I am.
Uh-huh.
And so afterwards, we had to go post these sticky notes on this board. And it was written down so many times. I'm like, how can all of us be
Yes.
terrible doctors, right? These are some
Right.
of the smartest women I know.
Mhm.
And it was shocking to me that they all felt the same way that I did. But yet
Mhm.
we are all very smart and great doctors in our own right. But yet we all feel like we're not good enough if we're trying to compare ourselves to other people, other doctors.
Mhm. It's not just women for sure. Like men have imposter thinking too. And part of it is, when we're in the gap all the time, it's the compare and despair. We're always going to compare ourselves
Mhm.
to the people that we think are better and never look at all the people who maybe are different or not as good as we are. So I think what I
Mhm.
love for you is that until you start having the conversations, that's the thing is it's so isolating when you just are stuck in your own head, afraid
Yeah.
to admit to anyone that you feel some of these feelings. It can be so healing when you start talking about it. And, for you, your retreat, for me and my coaching programs, there's, 50 women, all badass, amazing, smart, accomplished doctors
Mhm.
saying, I feel like a bad mom. I feel like a bad doctor. We are actually amazing doctors. Right. So
Mhm.
I think that can be helpful when you externalize it to someone else, which is what you're saying. You're like, that person is amazing. I see how hard she works. I see how smart she is. I see how much she loves her patients and takes good care of them and shows up so much for her family. But she seems to think she's not adequate. So then I'm like, oh, wait a minute. Maybe I, who do all those things also, maybe I am enough. You have to learn how to remind yourself that those
Yeah.
thoughts are lies.
Yeah. Yeah.
That's
Yeah.
what, being able to notice your thoughts can be so powerful because you just realize, but that would be the old tape that my brain would listen to. And now I'm like, come on,
Mhm.
Karen. No, she's a
No.
human being. She messes up too.
So one of the core messages that you've brought up a couple of times today is that self-compassion is like such a key part of healing. So for someone who's deeply entrenched in perfectionism or self-criticism, where do they begin?
Well, the simplest way to think about it is what would you say to your best friend? Listen to what you're saying to yourself. What would you say to your best friend? Would you say you're a terrible mom because you were late to pick up? Would you say your house is a disaster and or you're an awful doctor? You just would never say those things. They're really unkind. First step is just noticing how you talk to yourself. And for most of us, when we start to listen to that, like metacognition is thinking about your thoughts, looking at your thoughts or listening to them or noticing them. We're like, oh my God, my thoughts are awful and they're very negative for most of us. But the three things that are part of self-compassion, according to Kristen Neff, who's done a lot of research on this, is self-kindness. So what I was saying, talk to yourself the way you talk to someone you love.
Mhm.
Um, Mindfulness. So being in the present moment. What's happening right now is I forgot my laptop charger and my laptop almost died and I felt embarrassed. And that's all that's happening right now. And it's okay. If you're worrying about the future or if you're regretting something you've already done in the past, then you're not being mindful. You're not in the present moment, noticing what's actually happening. And then the
Yeah.
third part, which has come up a couple times already for us in this call, is the common humanity, which means we're never alone. For whatever reason, the human brain is designed to think that when you do something bad or horrible or embarrassing or that doesn't meet what you think is the standard, we think we're the only ones. And realizing everyone has a bad day, everyone fails a test sometimes, everyone's
Yeah.
clothes don't look good, everyone, gets whatever it is. Like life, we say in coaching, is the 50-50. It means half the time I'm going to show up and I'm going to love how I answer the question. And half the time, I'm going to not enjoy my job. Half the time I'll like it. Half the time I don't. Half the time I'm the kind of mom I want. Half the time I'm not. So it's
Mhm.
just realizing there is a balance and our
Yeah.
expectations are so skewed and they're so high for ourselves. And then they become so high for everyone else. And then we get disappointed. And then we don't know how to deal with any of these emotions that come up, shame or
Yeah.
embarrassment. We basically turn our feelings off as doctors
Yeah.
because we kind of are trained to do that. I think it starts with
Yeah.
noticing how you talk to yourself and trying to be kinder. And I think the part that feels really hard, I'm always teaching self-compassion to my coaching clients. And a lot of times people think I'm saying, well, just give yourself a free pass to be mediocre. That if you have
Right.
self-compassion, if you're nice to yourself, you'll just slack off and be lame and not achieve. But
Mhm.
the opposite is true. The studies show that
Yeah.
you perform better when
Yeah.
you are not mean to yourself. And if you think about a little kid who's struggling with something, because we tend to have self-compassion when things are going okay, but
Yeah.
God forbid we make a mistake or we hurt someone else, then
Yeah.
we are doubly mean to ourselves. Like a
Mhm.
kid is not going to get better at math if they fail a test and we like scream and yell at them and make them feel like crap. But that's what we do. It's like when you
Right.
encourage someone, they're going to be more likely to do better. And the data supports that. But that's, I think,
Hmm.
sometimes hard for physicians because we're used to just blame and shame. That's what we do.
Yeah. And it's hard when you feel alone in it. So it's nice when you can actually talk openly about these things,
Yeah.
and normalizing that we do make mistakes and
Hmm.
that we do not need to be perfect. We are not perfect. We
There's no such
will
thing.
make mistakes. We're trying to be perfect all the time. We're just setting ourselves up for failure, because that's just not something that most
And
people
we
can
move the
maintain.
bar. We move the bar. We're like, oh, well,
Hmm.
this, then we reach that. Just the narrative that it'll be better when. It'll be better when I
Yes.
finish training. It'll be better when this happens, when that happens. No, it won't. It's still going to be half good,
Yeah.
half bad. So you really want to
Hmm.
try to find the good things about where you are in your life right now, because there will be so many of them. And there's going to be bad things too, because that's being human.
What would you say to the mom who feels like she's just dropping the ball home, at work, in her relationships, and who secretly wonders, is it just me? Like, what would you tell her?
I would tell her it's not just you and like, welcome
Hmm.
to motherhood.
Yeah.
And, some of the hardest things you'll ever do is be a parent, but you can either help yourself through that by like sharing and being honest
Hmm.
and recognizing that this is part of it. But I think that's the biggest, this is the thing that I wish people understood. It's like we care so much about being parents. We are so hard on ourselves because it matters so much. But when you are beating yourself up, you show up worse as a parent. My kiddo like fell off the bed when she was 10 months old and bumped her head. And I was just like, oh, she's fine, by the way. But just in case this
Yeah.
happens to anyone else, because it kind of happens to all of us, right? I'm like, I'm the worst mom. I can't believe I did
Mhm.
that. I feel so horrible. Like, I also make it all about me. My kid just got hurt. Like, yes, if I care about her, but when you're in that guilt and feeling terrible about yourself, you're very self-focused, which makes you disconnected from the people you love and like want to be present with. It's not about me in that moment. It's actually about her.
Mhm.
But if I'm just like, yeah, this happens, it's okay. And let's take care of baby now, that's better momming than the shit, I'm awful, I'm in shame, and I'm so
Mhm.
flooded. I'm not even maybe going to be like, do I go to the doctor? Do I call an ambulance? That's not the best example. But another one I love to think about is like, it's so easy for us to judge ourselves based on how our kids do and to catastrophize into the future. So my kid's room is messy. And I'm just like, she's going to be a failure and she's going to live under a bridge and it'll be all my
Yeah.
fault. And I'm a terrible parent. And then I get dysregulated and I'm in that space of feeling,
Mhm.
again, like shame and failure that I'm not
Mhm.
curious about, or I'm not creative in how we think about problem solving the messy room, or I'm not even asking if it bothers her, or I'm not using the smartest part of my brain to
Mhm.
communicate and to talk it out with her because I'm already just in this I suck place. So I'm going to show
Yeah.
up worse. So it's not even that thinking like being kinder to yourself just makes you feel better. You will show up better for the other people you care
Yeah.
about when you're not feeling so bad about yourself.
Yeah.
It's really hard to be loving and present when you're like, I suck, I suck, I suck, I suck.
Mhm. And I'm also thinking of, like, if you're sick and you're going into work and you're not feeling very good, you're not gonna be your best self, and you're
Yeah.
not necessarily gonna be helping your patients all that much if,
Mhm.
like, with me going to work every day when I was just so burnt out, slamming doors, yelling at people, telling people they were the worst patients, that wasn't good for them. And all that was because I wasn't taking care of myself and I wasn't able to be fully present with them. Really important to take care of yourself because you're not going to be able to show up very well for other people if you're not cared for.
It is so true. And our judgment is so bad at that, which
Yeah.
is why sometimes I think we need to outsource it to someone else. Like, I can't tell you how many people want to go into work sick and whatever. I try to
Yeah.
talk them out of it, or I'm just like, this is crazy, and then after when they've been out, if they listen to me, they're like, I went back to work and I was such a better doctor. I had more
Yeah.
energy. I cared more. I was smarter.
Hmm.
So it's this idea. It's another thought error. It's like I need to stay up super late working harder, but if I went to sleep and had a good night's sleep,
Yeah.
then the next day I would get more of my work done. It's undoing a
Yeah.
lot of these false beliefs we have, or like with perfectionism, like I talk so much to my clients about our notes. We think I'll write a better note later. It's like, no, you won't. two
Yeah.
weeks, 2 weeks from now is not a better note. Do it now. Do it crappy now. It's still gonna be better than the 2 weeks from now when you don't remember anything. And you will
Mm-hmm.
have more time for you. So it's like we
Yeah.
have to start unlearning some of these beliefs we have that actually create the opposite of what we want.
Yeah. Yeah. You can't pour from an empty cup.
You
That's
can't.
one thing. Yeah.
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 But we know that, right? You knew that. Like you
I
knew
did.
that. So
And multiple people told me I should be off work.
it's knowing
Um,
versus like feeling. You knew
mhm.
that, but you felt like if I don't go to work, what does it
Yeah.
mean about me? I feel ashamed or I feel weak or
Mhm.
so unless you work through some of that stuff, it doesn't matter that you know it. It's kind of like knowing we should eat healthy and exercise. Well, what good is it to just know that? How do
Yeah.
we actually do it? And
Yeah.
that's where we have to shift the way we're thinking if we want to
Mhm.
act differently, which you did amazingly. And like,
I
I'm so
did.
happy you
Yeah.
shared that you were open to going to therapy because
Yeah.
there's so much stigma in the
Yeah.
professions. And like, yeah, like I always talk about, I take medicine for anxiety and I take medication for ADHD and I think therapy is wonderful. And I've invested in coaching and I'm like, do all the things to make yourself feel
Mhm.
better. There's no shame in that.
Yeah.
I think it's wonderful that you got yourself to such a better place. Let's give you credit for that too.
I love therapy. It was something I was always afraid to do for a long time. I started going to therapy and I was like, wow, this is really helpful. And it's nice to have somebody call you on your
Bullshit.
baloney. I like when somebody calls me on my bullshit and corrects me on my way of thinking. And sometimes I need somebody to tell me that.
We
So even
all
though I
do.
am well now, I am loving being back in medicine, although I'm not full time anymore. I still go to therapy because I think it's just so helpful. And yeah, I think it's
Well,
good for
I
my mental health to
I
go.
think sometimes people think like I have to be, it's the same thinking. I need to be so sick to go to the doctor. I need to be
Yeah.
so unhappy to go to therapy. I need to be
Mhm.
so struggling to hire a coach. And I'm
Yeah.
like, that is so backwards. I'm like, I will never go without a coach. And I'm the happiest I've ever
Yeah.
been in my whole life. But I
Yeah.
want to keep learning and growing and expanding what is
Hmm.
possible for me. And I see that in you also. So it's just a
Yeah.
very different paradigm. We're not like fixing anything. We're just
Hmm.
meeting us where we are and helping us like keep being the best us. I think
Yeah.
it's amazing.
Yeah.
Yeah.
When I was sick, I ended up having to go for surgery, and so I did take 3 weeks off after my surgery, even though I was supposed to take 6. But during the 3 weeks, I was like
And so,
relieved. I was like, I know, but I was like relieved. I'm like, wow, this is great. I've got this time off. But really, like we need to learn to take that time off before and to take care of ourselves so we don't get to that point. And
I
having
know.
surgery is not a vacation.
It's
Really important
not.
that we take care of ourselves all the
Yeah.
time. You're an ambassador for the Lorna Breen Foundation that focuses on clinician well-being. What do you wish that all physician moms understood about protecting their own mental health before they hit the wall?
Yeah. I mean, I think it just comes down to being okay if you need help, you know,
Yeah.
and we are messaged from medicine not to need help, and we are messaged from society to be the help. It is so hard for us as women to ask people for help, which is crazy
Hmm.
town, but it's just part of it. So I want people to know you matter and you can't help other people if you're not okay. So take care of yourself and get help,
Yeah.
even if it feels uncomfortable to have to admit to some of these things, because you're way
Yeah.
too precious. Way
Yeah,
too precious.
absolutely.
Yeah. Even when you think you're not doing a good job at anything, you are doing such a
Yeah.
better job than you realize. And sometimes
Yeah.
you need someone else to remind you of that. I definitely did.
Hmm.
And you probably did too. Yeah.
Yeah, for sure.
Yeah.
And just realizing that you're worth the time to
Yeah.
to sit back and take care of yourself.
Well, remember I was saying one of the things, one of the thought patterns is the scarcity mindset. And it's like,
Hmm.
yes, we don't want to invest the time in having more time. We don't want to invest the
Yeah.
money in having more money.
Mhm.
You're worth investing in. And you can't keep putting everybody else's needs ahead of your own. You have to take care
Yeah.
of some of your own too. Or look what
Yeah.
happens to you, you know?
For sure. For
Hmm.
sure. Your body will eventually stop you. You do hit a wall after a while. You just can't continue. Karen, where can listeners find you?
You can head over to my website. It's www.karenleitnermd.com.
And I'm going to be putting all of your links in the show notes. And tell me about this free mini course that you have.
Yeah, so I have this mini course that's called Life Support for Women Doctors. Although, if there are non physicians who listen to your podcast also who are in healthcare, I think it could still be really beneficial. And you need to use a little code. The code is going to be free mini, all one word. It's nominal, it's $27, but I would love your listeners not to have to pay. And I
Yeah.
basically put in there my best tips on, charting in your inbox and setting boundaries and overcoming some imposter thinking and how to negotiate. That doesn't just apply to money, but with your spouse or with your toddler, like these tools are very
Mhm.
valuable. I'm trying to help women physicians' lives be easier, both from an emotional standpoint, but with the sheer amount of work that we carry. So people
Yeah.
have watched it and said, I don't bring home charts anymore, or I got this great raise. And so it's a nice little way to sort of, without investing a ton of time, still make some big changes in how you're showing up in your life.
You also have an 8-week course coming up in October.
I do. So this is like the 15th or 16th time I run this program. It's 8 weeks long. It's called How to Feel Better for Female Physicians. And it's in the US and Canada. I offer CME, and it basically helps us take this work and really apply it. So it's a lovely community of women, just like we talked about, who aren't afraid to discuss and share openly some of the challenges we face. And then I just teach a lot of in-depth tools and strategies to help manage better in life. And over 500 people have done it, and it's really fun. And anyone's welcome to reach out to find out more.
And they can find out about that on your website, correct?
Yeah.
Awesome. Karen, thank you so much for joining me today and for sharing your wisdom with such honesty and warmth. I love this conversation. I know that a lot of my listeners are going to walk away feeling seen and supported and maybe a little bit more inspired to be a little kinder to themselves. It was a gift to have you here today.
Oh, thank you. It's nice to talk to you.
And thanks to all of you who are hanging out with us on Paging Dr. Mom. If you enjoyed today's episode, go ahead and hit follow or subscribe so you don't miss what's coming up next. And if you want to keep the conversation going, you can find me over on Instagram at drangeladowney. I would love to hear from you. Take care for now. You are doing better than you think. That is it for today's episode of Paging Dr. Mom. If it made you smile, nod along, or feel just a little more seen, then go ahead and hit that follow button and share it with a friend who needs to hear it. Take care for now. You are doing better than you think. What if just a few minutes a day could help you understand yourself more deeply and finally start breaking those old patterns? My 365-day journal is designed to do exactly that. With gentle, daily prompts, it helps you explore how your childhood relationships shaped your beliefs, emotions, and the way that you show up in adult relationships. It's available in several beautiful colors now on Amazon. Just search Enough as I Grow by Dr. Angela Downey and start your journey forward. Now, back to the episode.